Hey everybody, it's Rob DiNicola at Yeshiva Medical. Thank you for tuning into my vlog again. The reason for this short little video is really explain, the biggest challenge that sales professionals in medical sales and pharmaceuticals face day in and day out, besides access, is when they do have a chance to talk to a healthcare provider, the default setting is always no. And there's a really easy explanation why no is the default setting for most providers. And that is because they're happy at what they're currently doing. Whatever their treatment algorithm is, they think that what they're doing is fine. They see good outcomes for the most part. 9 out of 10 times, there's really no reason in their mind to change. And change to everybody, for the most part, is a pretty scary idea. But for doctors and providers, it's really scary because change is equal to risk. And the last thing that they would want to do is expose themselves to risk, their patients to risk, when whatever they're doing probably is satisfactory. And the key thing for anybody in the sales profession is really delivering compelling data, compelling reasons why making a change from one drug or one treatment option or one surgery to another or a service to another is the benefit not only of the healthcare provider, but again, in the best interest of the patient. It goes back to an earlier video where you always put the patient first in anything that you sell, because ultimately, that's who we serve, is the patient. Whatever product, drug, surgery, service that you provide out there, hopefully it really provides a huge benefit to the patient over the competitors. That's something that really needs to be on the forefront of your mind. So, doctors are always going to say no. And that's why if you're doing your job and maybe you have a company that has the old pharma mentality where they want you to make 7, 8, 9, 10 calls a day, where you really don't get those quality interactions that you want to with providers. And for the most part, you become a glorified UPS man by just dropping off literature. You're not going to really make that difference that you need to basically paraphrase Mace Horcraft, who's a really good sales guru in medical sales. By just leaving literature behind at doctor's offices when you can't get access, you're actually working against yourself, because most of the time the marketing pieces that we do have are meant to be used during a conversation with the provider. It's there to give visuals, provide some visual stimulating recall ability for doctors to kind of see what you're saying. And by just leaving them at the front desk or just tossing it on the doctor's desk, for the most part, the provider is going to look at it without any context and see that it's probably no different, or it doesn't compel them to think that it's different from whatever treatment or procedure they're doing right now. And that is basically a lost opportunity to have a effective conversation to really go into detail about why your products, your services, your drugs make more sense than whatever they're doing right now. And it's really hard. You're challenging their mindset, their treatment algorithms, what's worked for them in the past. So it really behooves you to know your product inside and out, know the other treatment options out there inside and out, and really be able to offer them compelling reasons to think about changing. You have to be an expert in whatever field, whatever disease state, whatever surgery that you represent. Because if you can't give them a compelling reason to say yes when their default setting is no, then really what can you expect to achieve when you're having these meetings? So, it's really something that we need to think about, and why it's always so important to pre-call plan when you go into an office about what you're looking to achieve during the call. What's my A goal? What's my fallback B goal? What's my fallback C goal? All right, there should be multiple goals for each call that you make. And it shouldn't be just dropping off literature on a business card and praying for the best. And again, you should really be thinking about, how do you change that default no to a yes? What information do you have that might make that provider upend what they're doing, add an element of risk to their practice, which again, their whole life they're trying to minimize. And that's really where the best reps shine, is the ability to really understand the business, understand their disease state or products and their competitors, and understand the providers and what they're looking for, and why they think the way they think, and how to best position whatever it is that you represent in a way that is beneficial to the patient, so it makes that healthcare provider rethink what they do when they go to treatment. So, I think this is something that we should always keep forefront in mind, and then the best reps are always doing this and putting this plan into action. So I'd love to hear any feedback that you guys might have, and hopefully I'll see you all again soon.